The word croup has been around for a long time. What is its definition? Well, back in the 1500s, it meant something a little bit different. Back then, to croup was a verb, and it meant to cry hoarsely. It was used in a very similar way to how we used croak today, and it might have been used like this. Lady Wit Huntingshire was up too late screaming at the latest boy band concert, and could only croup her orders for breakfast down to the help in the morning. Well, that usage gradually fell out, but it did enter the medical literature. And sometime in the 1700s it began to mean what we think of it as today, and that's an infection of the upper airway. It goes by another name in the medical literature, laryngotracheobronchitis. You can see why we go by croup. So at this point it helps to know a little bit of anatomy. So let's talk about the upper airway. So the cartoon that I've drawn is a side view of the airway, as if you were looking at somebody's neck from the side. Up here at the very top, we have the nose. The nose is separated from the mouth by the palate. The airway at the back of the nose is called the nasopharynx, and the airway up by the mouth is called the oropharynx. Below the nasopharynx and the oropharynx, we have the larynx, which sits in this region here. And below the larynx is the trachea. This is where that big long other word for croup comes in a little bit handy, actually. You can see here the root words for the different structures that are involved. Here we have laryng, which refers to the larynx, next to tracheo, which refers to the trachea, and then bronch, which refers to the bronchi, which are the airways lower down a little bit in the lungs. And then at the very end we have itis, which of course means inflammation. So this is inflammation of the larynx, trachea, and bronchi, but still it is a lot easier just to say croup. So we already mentioned that croup is an infection, and infections have causes. In the case of croup, it is almost always viral, and the classic virus that's associated with croup is called parainfluenza virus. Most people just say paraflu for short, but that's not the only one that can cause it, it's just the most common. Other viruses, like adenovirus, or even RSV, or respiratory syncytial virus, can cause it. In fact, almost any virus that affects the airways can cause croup. So there's quite a bit of overlap in the symptoms of croup with those that cause other respiratory illnesses, particularly the common cold. So what actually happens when you catch croup? Well, as these viruses affect the respiratory system of the larynx and the trachea and the other large airways, they become quite swollen. So here we'll draw in swelling of the wall of the larynx and the trachea. And you can see right away how this is going to cause problems. We'll erase a little bit up here to give ourselves some room so we can talk about the symptoms of croup. When something happens to this part of your airway, your body's natural response is to cough. So patients with croup invariably have a cough, and that cough can be pretty severe. The edema can cause so much swelling in the airway down here that the tissues become redundant and they get a little bit floppy. So as you're trying to cough and force air through these airways, those tissues vibrate, and that gives people with croup a really distinctive sound to their cough, and that sounds a lot like a bark, and particularly a seal bark. So even when they're not coughing, people with croup often have stridor, and stridor is noisy breathing. But it's a particular type of noisy breathing where the sound comes from these inflamed airways. This is different than wheezing. Wheezing is abnormal sounds coming from the airways, but much lower down in the respiratory tract. And because croup is caused by these viruses, oftentimes there'll be concomitant cold or other respiratory type symptoms. Those are things like fever, runny nose, and congestion. These things often will precede the croupy part of the illness. Or sometimes you can just get croup all by itself and not have any of these other symptoms. So let's erase a little bit more to give ourselves some more room. So most people are aware of the fact that croup is a disease of children, and croup tends to be a disease of younger kids, less than about 6 years old. Why don't adults get croup? Let's draw a picture of the airway, but this time instead of looking at it from the side, we'll look at it from the top. So let's say this is a part of the upper trachea, or the larynx, and this is in an adult. An adult's trachea might be about 15 millimeters in diameter. Kids less than 6 have much smaller tracheas. Their tracheas tend to be more around 6 millimeters in diameter. So let's draw that inflammation in again for both of these sizes. And we'll draw the same amount of inflammation for each one. So here I'm adding a couple of millimeters of swelling to this tracheal wall. So you can see what's happened here. The proportion of area that the air has to move through is this green circle in the middle. And it went from a reasonable size at 6 millimeters, and by adding just 1 to 2 millimeters of swelling due to inflammation, we've cut that area significantly. And that's why kids that have inflammation of these large airways tend to get much sicker than adults. In fact, for this reason, somewhere around 2 to 4% of kids who get croup will end up in the hospital. Now that may not sound like a lot, but when you consider that about 15% of all kids in the United States have had croup, that's a tremendous burden on the pediatric healthcare system. So let's look at a real-life example just to drive things home. Here is a normal x-ray of somebody's neck. I'm going to label some of the structures that we've talked about. We can start up here at the nose. This is where air starts. It goes in through the nasal cavity, into the nasopharynx and the oropharynx. And then at this level, it enters the larynx. And this is the larynx here. In fact, on this radiograph, we can see where the vocal cords are. The vocal cords live in the larynx, right here. Below the larynx, we have the trachea. And we can't see all of it on this radiograph. It goes down into your chest. And this is a nice normal radiograph. Let's contrast that to a younger child that has croup. You'll notice this child has his mouth open and he's breathing through his mouth. And you can see the oral cavity really well. And you can see where the nasopharynx here joins with the oropharynx here. But now we start to see some differences. We can't see the normal larynx. It looks gray and blurred out. It should be in this area here. And below that, the trachea doesn't look normal either. It's very small, and it also looks kind of gray and almost blurred out. That's because of that inflammation that's narrowing everything down. You would expect this child to be having quite a hard time breathing. And indeed, this particular patient had to be admitted to the hospital.